My name is Glynn. I'm a rural GP here in Ballyvaughan in County Clare for the last 24 odd years. I also have an academic role in the local university, the regional university, University of Limerick. Where we are is we're in a lovely coastal village here in the north coast of Clare called Ballyvaughan. It's traditionally would have been a fishing community. But now I suppose the main driver of the economy here would be tourism. It's a beautiful village, it's a small village. The census population would be around 250 people. Obviously our practice is much bigger than that. Our population is spread over about 600 square kilometres. So we have all the challenges of, a proper rural general practice. Those are dispersed population, high levels of deprivation, and a predominantly elderly population. But if you want to practice in an environment which really challenges you clinically, and also in which through that relationship-based care, which is a real characteristic of rural general practice, and that lovely continuity of care that we have with generations of the same family, I think you can feel really confident that you are going to have a significant impact in terms of health and well-being throughout your career. And I think that's one of the most professionally fulfilling and satisfying aspects of the career, and that's why I'm committed to this practice until I retire. I give a talk at the trainee conference on myth busting around rural general practice, because I think there is a lot of misconception about it. First of all, that it's generally this much older GP driving around in a Jeep on country roads. But in fact, most of the recruits into rural general practice in our area have been female recently, and young females at that. I think also this idea of GPs working in complete isolation, and I think that's becoming, I think solo GPs are becoming a really endangered species, and that's probably a good thing, because I think we need to work together. In our practice, for example, we're all part-timers, but there's 3 of us managing a single practice, and I think and besides us as GPs, we have this large multidisciplinary team around us. So I think rural practice, like most other practice, has really transformed into a team-based approach. So I think the idea of working in isolation, that is historical, So I'd reassure people that there is, this team-based care. That's how we deliver care. I think the other myths around things like GPs working longer in rural practice, we know the most up-to-date research on workload in Irish general practice demonstrates that actually rural GPs work shorter times. And that's probably something that, it's not probably, it's something that's seen in research from around the world, and I think that feeds into this idea that we probably have a better work-life balance, not only because we live in a beautiful environment where we can go for a sea swim at lunchtime, but also because we probably work shorter hours than our urban counterparts. At least that's what the research is showing. And the research also confirms that working as a rural GP is protective against burnout. So there's something about the work-life balance that we have in rural general practice that is really positive compared to a lot of other environments. And I think that's a myth, and it's a conception that isn't out there. And I think GP trainees who are interested in coming to work in rural practice and living in these type of communities need to realize that there is a really positive work-life balance that can be achieved, and also that one is really embedded in your community and also can have a really impactful effect in terms of health and well-being. The health system has realised what general practice is capable of doing. I guess we've always known it as GPs, but throughout a lot of my career, I really felt that people didn't quite understand the capability and ability in general practice to deliver on all sorts of levels. And I think for the first time now, particularly with the chronic disease management program, we're being incentivized to deliver that sort of high quality care. But most importantly, it's brought resources into practice, because we have to start to think about that team-based approach. We have to increase our number of practice nurses in order to deliver this complex, high quality care. But I think I really urge GP trainees out there to think about also, the idea of being your own boss, I've always found incredibly attractive, don't give up on that idea. And it's great. That's why I'm really delighted when I see, some young GPs coming together and taking over a practice. And not only does it allow them to, I suppose, share the responsibility community and the management aspects of it, but also it allows them to develop it to their own liking, rather than, I suppose, being at the behest of somebody else in terms of how your own career and your practice might develop. So I think the resources, much more resources have come in to general practice, which is allowing us to develop the service in the way that we want to develop it. So don't give away that responsibility to other people. Don't give away that ability to really influence the type of care that you want to deliver. And I think the place that I've seen the greatest, I suppose, ability to shape that care personally is in rural general practice, and to really develop a broad level of service and a really satisfying professional life in terms of having an impact on health and well-being. So be a rural GP.